National Leprosy Eradication Program, an initiative to eliminate the leprosy in India. It speaks about chronic infection disease caused by Mycobacterium leprae, mainly affects peripheral nerves, also affects skin, muscles, eyes, bones, testes, and internal organs. One of the important causes of permanent physical disability. Leprosy was eliminated at global level in year 2000. Criteria for elimination of leprosy as a public health problem is less than one case per 10,000 population. Epidemiology, when we speak, we basically know the epidemiological triad connections for infectious diseases like age and host and environmental factors. So agent factors, agent is Mycobacterium leprae. Source of infection is like untreated leprosy or affected with. Portal of exodus from the nose majorly and ulcers or broken skin. Environmental factors are the poor ventilation, overcrowding, humidity, lower socioeconomic status. Host factors comes with age, any age, but peakily more than 20 to 30 years. In gender, males are more dominant to get the infection. And in cardinal features, first one is skin lesions with loss of sensations. Thickened peripheral nerves. It would be seen on the radial nerves on the elbow side. On different aspects, the thickened peripheral nerves. And the demo of the acid fast baseline skin smear. In other few features are the skin lesions, what you have it, and the thickening of the back skin, different colorations. And dividing into two basic important classifications of paucibacillar leprosy and multibacillar leprosy. So in paucibacillar leprosy, as we saw the lesions, skin lesions will be 1 to 5 skin lesions in paucibacillary. There won't be any peripheral nerve or maybe at least just one single peripheral nerve involved. And skin smear showed negative at all sides. So this is a consideration for paucibacillary. Other side, where there are many skin lesions, more than 5 skin lesions, 6 and more skin lesions, more than one peripheral nerve involved, basically meaning 2 and more peripheral nerves involved, and skin smear showing positive at any one site. So these are the conditions we call as paucibacillar leprosy and multibacillar leprosy. Clear? So now moving on to the flowchart for diagnosis and classifications. Skin lesion with a sensory loss. So you think about leprosy. So then you need to see that you may do a skin smear test. As the same way how we do the three things, you will check for how many areas there is skin the sensory loss, and when you see a skin smear test. Okay, so with the if the skin lesions are less than 5, we think about as a paucibacillary, and more than 5 skin lesions we think it as multibacillary on a clinically classified. Then we check on the laboratory classification wise as when skin smear test has been done. So when that has been available, we check it, and if skin smear test is negative and less than 5 skin lesions, we consider as paucibacillary leprosy, confirming it. And other one is by skin smear is positive and multibacillary, more than 5 skin lesions, we'll confirm it as multibacillary leprosy. And now we move on to NLEP program. Okay, a very important signature of it, the symbol. So NLEP was launched in 1955 as NLCP, and it moved on to 1983 as a NLEP, replacing NLCP, and they introduced a multi-drug therapy for it. In 1991, WHO set the global goal for prevalence rate as less than 1 per case in 10,000 population. India adopted this goal and accelerated the efforts toward it. 2005, India achieved the leprosy elimination target at the national level with a prevalence rate of lesser than 1 case per 10,000 population. In 2016, they launched leprosy case detection campaign called as LCDC as focusing on active case detection high burden areas. If there are any areas, you will do the camps and campaigns to get whoever is positive there, or is there anybody who is positive. 2017 launching a SPUS leprosy awareness campaign to reduce stigma that leprosy people cannot be touched. If you go near them, you get them. Too much stigmas existed that people won't be there to give the care and all. So SPUS leprosy awareness campaign was started in 2017. In 2020, National Strategic Plan for 2020 to 23 was launched focusing achieving a leprosy-free India with zero grade of 2 disabilities among new cases. If a new case is found out, it should never go to the next grades. So that was the idea about leprosy-free India. Overview: the National Leprosy Eradication Program is a public health initiative aimed at eliminating leprosy as a public health program. Components are decentralized integrated leprosy services, training in leprosy to all healthcare functionaries, intensified information, education and communication, prevention of disability and medical rehabilitation. Even in case if they get the infection, it should not go to the next level grades where disability occurs or any condition. So it should be prevention from disability and medical rehabilitation. Intensify the monitoring and supervisions. Objectives of NLEP as elimination of leprosy, as we spoke for 2 to 3 times about it, below 1 case per 10,000 population. Early detection and treatment through free multi-drug therapy, which was invented, which was started as when the program was changed to the NLEP from that time. Prevention of physical disabilities, awareness and stigma reduction, socio-economic rehabilitation for the patients. Initiatives, what is done for it. So new case detection given more focus than the prevalences. So because it's on the elimination side, you need to know if there's any one case which has been missed out to pick that up. Considered a public health problem if the prevalence of leprosy is more than 1 per 10,000 population. Treatment completion rate has to be calculated by the state by at yearly basis, and it had to be improved on a each yearly basis. Disability prevention and medical rehabilitation, as ulcer kits were given, dressings, medicine, microcellular rubber, footwear, so that leprosy people has less sensations, so that they should get injured and the bleeding should not happen. So MCR was given with the whole care and the cushioning effects. Reconstructive surgeries were done and incentives was given to the patients. Not the reconstructive surgery was basically not to lead them to any other more complications and great disabilities. Asha's search, follow up, motivated, advise and spread the awareness among the people. Free services in 612 colonies fortnightly or weekly basis. IEC campaigns towards the leprosy free India, on different way the campaigns going on, the information has been spread. Okay. And achievements of NLEPs: leprosy elimination achieved nationally in 2005. First point. Continued efforts at sub-national levels for high prevalence districts, whichever it has a bit more prevalent areas, more care is given, more interventions are done. Reduction in deformities through early detections. And current challenges: what are the problems what's facing with the program? Hidden cases in marginalized populations, stigma and discrimination against the leprosy patients, monitoring for drug resistant to MDT, the multi-drug therapy, maintaining the trained staff and resources for effective delivery of each of the system to manage this increased or a very prevalent areas. Wherever there are cases are prevalent, a bit more in any districts, there how to be maintaining the staff and how to effectively deliver it.